Section 2. By the end of this section, you will learn the patient experience and journey through the network. So Tara, what would a patient experience of the network look like?
Well, Lucy, each patient experience is unique, and the network has been built up around that. I'm going to describe a possible journey of a fictional patient through the network. Patient A is a young lady with a background of severe sexual abuse. Her abuser is in the UK, in prison, tried for similar offences but was never tried for hers. She has been in prison herself for drug offences and has a long history of substance misuse. She suffers from depression, regularly self-harms, and experiences intense and frequent and distressing flashbacks and nightmares. She's been referred to the network via her GP, and she's motivated and engages well. She starts the 12-week skills programme, joins the group, and very, very slowly starts to manage her emotions, and her self-harm starts to reduce. She's doing well, and at the end of the 12-week programme, she's stable enough to start her Phase 2 trauma intervention. Phase 2 trauma intervention uses eye movement desensitization reprogramming. We call it EMDR for short. This is a nice guideline intervention which specifically targets flashbacks and nightmares. She's doing quite well with her individual therapist from the trauma network, but unfortunately she hears something over social media. She finds out that her abuser has been released from prison and she wasn't informed. Unfortunately, this sets off a period of intense destabilisation again. The specific trauma interventions at Phase 2 have to stop for a while, and she's re-referred back to the skills group in Phase 1. Because her self-harm has increased, she engages again for 3 or 4 weeks, but because she's already been through Phase 1 and she already has those skills, it takes less time for her to build them up again. And after 3 or 4 weeks, she goes back to her individual therapist and restarts the EMDR and the specific trauma work. It does take many months for patient A to experience a reduction in her flashbacks and nightmares, but she starts to notice that they are far less frequent and her recovery rate from them is much, much quicker. It gets to a point where she's starting to think that she'd like a little bit more structure in her life. She'd like to get back some of the things that she's lost through experiencing these terrible symptoms. She's also been engaging in the drug and alcohol service, so her methadone program has been managed effectively as well. She starts to move on to the Phase 3 of the network. This is the maintenance and recovery phase. At this phase, there's a slightly different therapeutic approach. The therapist uses more relational therapies, such as schema-focused therapy or cognitive analytical therapy. These therapies help patient A challenge her deep-seated beliefs about herself, her interpersonal relationship with others, and how she sees the world. It's not a quick therapy, and it does take many months, but she does slowly start to see an improvement and tends to be less triggered by people around her. She's also starting to think that she'd like to get back into some more work, some not necessarily paid work just yet, but certainly some voluntary work. So we engage with our care partner, who's also part of the network, and the care partner liaises with the Jersey Employment Trust to see if we could set up some voluntary work for patient A, and for them to also help her with her CV, which they do. Patient A also used to really enjoy playing football, but has struggled to find a way of getting back into it. So we involve a close friend of hers, and she helps her attend her first football session. At the end of the therapy, which may take months and if not a couple of years, patient A is given a graduate passport. This is a small document that has all the names and the numbers of the people that she's had contact with in the network. She's also invited, when she feels ready, to engage with the skills group as a co-facilitator and a graduate of the group.
Tara, that sounds like a really positive and a successful experience a client has had through the network. We know that trust is a key issue in complex trauma. What happens if somebody disengages from the network?
Well, that can happen, Lucy. And I could describe a client B, who that did happen to. Client B is a young father of 3. He experienced severe childhood sexual abuse in early adolescence. And his abuser was never prosecuted. In fact, his abuser is still living in the community. He was referred to the network by his GP because this man was increasingly agoraphobic. He also experienced severe and distressing flashbacks and nightmares and was self-harming quite prolifically. Because he couldn't leave his home, his agoraphobia was so severe, we engaged the outreach aspect of the skills group, and an individual therapist from the skills group visited him at home. This man also was highly avoidant of his anxiety and did have some ambivalence regarding therapy due to some deep-seated beliefs about mental health and weakness. But for a couple of sessions, the DBT skills therapist visited his house, and he was persuaded after 3 or 4 sessions to perhaps attempt to join the group. When he did join the group, he found it very, very distressing, and so he was offered the outreach aspect again, and the DBT therapist went back to the house to engage with him there. Unfortunately, on one of the rare occasions that he was able to take his children to school, he bumped into somebody at the school gates and heard some information about his abuser that triggered a very, very severe spout of self-harm and very, very high spike in his anxiety. He could no longer tolerate engaging in any kind of intervention in terms of the skills group at the moment. But what we recognised at the network was this was an individual still very much in need of the service. And so what we arranged was for the care partner to liaise with Mind for the peer support service. And one of the peer support workers came to the house every day just to help this man get out, this gentleman, so he could walk his dogs, knowing that the network was there if he ever felt ready to engage again.